Good afternoon, everyone, wherever you are. This is the webinar, which is being hosted and organized by the HEAD Foundation. It's the second in our series, and we are fortunate to have three very distinguished panelists joining us today. I will introduce them to you a little bit later. Let me just perhaps spend a few minutes giving you the context of perhaps what we hope to be able to discuss today. So the topic is COVID-19, what's next? And let me sort of start by saying that, as we all know, human well-being and security has improved dramatically in the last 100 years. And it's largely due to mainly three factors: the advent of globalization, of course, economic development, and in the context of COVID, of course, health improvement in all countries all over the world. And then this happened. And of course, everything changed. In her book, The Year of Magical Thinking, Joan Didion had this to say: life changes fast. Life changes in the instant. You sit down to dinner, and life as you know it ends. So today, in the context of change, we will ask sort of three questions. What changes can we expect in our lives, our work, economies, and public policies? Does change mean deglobalization or the end of globalization as we know it? Will all these good things like economic development, health advances, and human well-being actually be derailed in the post-COVID-19 era? And finally, what is our compass and our guide to get back on track, to restart humanity in a way, and to continue and maintain sustainable human development? I think all of us know in the year 2016, a global compact was announced, which I believe can act as our compass and guide in terms of restarting humanity. And we all know this as the Sustainable Development Goals, the 17 goals to transform our world. In the context of COVID, of course, the focus is on SDG number 3, good health and well-being. If you look at the top row, it is also important to realize that there are many other SDGs which are closely linked to health. Clearly, poverty, hunger, education, clean water, and sanitation. So they are closely linked to health. But many of the other SDGs are also linked to health. In fact, if you look at it, there are at least 33 health-related indicators across 11 SDG goals. For example, decent work and economic growth obviously has a lot of health repercussions. Gender equality, another SDG where health clearly features prominently. Sustainable cities and communities, and obviously the environment and climate action, and last but not least, obviously the importance of partnerships for the goals. So that's really all I want to do to set everything in context. To go back to our first question that I'm hoping our three distinguished panelists will try to provide some answers to. What changes can we expect in our lives, our work, our economies, and our public policies in the context of that compass that we have in the SDGs? So before I introduce our first speaker, I would just like to make an administrative announcement to everyone who's online. We would like you to start posting your questions under the Q&A, even as presenters are presenting their interventions. But we would also like you to vote on the questions. This would make it easy for us at the end when we discuss the Q&A to see which are the most popular questions, rather than me as a moderator just randomly picking these questions. If you look at the Q&A, you will see a little thumbs up sign, okay? Vote for the questions that you like, and then will enable us to figure out what are the most popular questions. Okay, so it's my great pleasure now to introduce our first speaker, Professor Danny Quah, who is a distinguished and prominent economist. He is the Dean of the Lee Kuan Yew School of Public Policy, where I'm based. And he was also the founder dean of the Saw Swee Hock School, Center for East Asia at the London School of Economics for many, many years. So, Danny, over to you for your intervention.
Thank you, Tikki, and thank you for setting such a broad panorama against which to have our discussion. Just a second while I pull up these slides here. So you've formulated for us a mission, which is to try and think through what's going to happen in the world against a background of the SDGs. To try and address this, I would like to make 3 points. Okay. The first is that we must never forget COVID-19 is a horrible tragedy. It's a horrible tragedy many times over. As a consequence of that, my second point, everything will be more difficult going forwards. The question that's before us is, what can we do? Now, when I say it's a horrible tragedy, I'm not placing here hyperbole. It is, from an economist perspective, a supply shock, a demand shock, a financial market shock, an international trade shock. It is every shock that you can imagine studying, all coming together. As a result of that, world growth is probably going to be lower by 4 percentage points over this coming year. That is sufficiently headline grabbing. But of course, the real headline is that today, there are now almost 6 million people who've been infected worldwide COVID-19, with the US and Brazil leading the pack. Over 350,000 people have been killed as a result of that, a third of that in the United States alone. The transatlantic nations, the United States, Brazil, the second highest number of COVID-19 infections, the UK, the second highest number of deaths. It is a transatlantic and global tragedy. On top of that, COVID-19 has provided humanity a blank slate on which humanity has written our worst fears and our greatest challenges. So as if COVID-19 were bad enough if we were dealing with it rationally, we have layered on top of it almost the worst that humanity has to offer. Because what do we have now? COVID-19 has come after almost a decade now of a renewed geopolitical rivalry, US-China geostrategic competition. The coronavirus has been politicized against a background of this longer run geostrategic struggle for great power leadership. It's coming in a US presidential election year. And in America, no one ever loses votes campaigning against China. These two great powers are now contending with each other. There's a blame game going on about who is handling the coronavirus crisis the worst, who's been hiding information, who's been mishandling, mismanaging things. It is a terrible time, if it weren't already a terrible time with COVID-19. International collaboration today is needed more than ever. And just at this moment, the world's political leadership decided to leave the building. It is a terrible time to be having this pandemic. Hand in hand with this geostrategic competition is deglobalization, the retreat from international trade that, as you yourself said at the beginning, Tikki, is one of those things that has brought untold prosperity and lowered the security problem that the world has faced. So deglobalization has given way to already, with pre-COVID-19, an emerging nationalism, a feeling of us versus them, and insecurity about strategic industries. And who knew all of a sudden strategic industries includes toilet paper? We are now pulling back more than ever from an over-reliance on international trade. This will result in a massive change in the way we understand the world's economy. So my first problem with when COVID-19 is happening, geostrategic rivalry, deglobalization. That's already bad enough. The second thing that this is coming on top of is a great concern over social inequality. Even before COVID-19 began, a lot of the world has been watching and stalking and blaming the top 1% of every nation's income distribution. Now, with COVID-19 on top of that, many have picked up the line that says the coronavirus has exposed even more pungently the ills of an unequal society. These observers look around at the rising infection in Singapore, crowded foreign worker dormitories, but across the world, in favelas, in shanty towns, in ghettos, in council housing, in prison, in aircraft carriers. It's too easy to forget in the midst of all this chest beating about a social class war that the coronavirus seeks only to spread via its droplets. It does not care about ethnicity or income class or occupation. And this spread can happen just as easily in a crowded construction worker dormitory as it can in a packed, high-income social gathering or a rich, gated community. The third issue that one might have with when COVID-19, that adds to this terrible tragedy that COVID-19 is, it's coming in the midst of a worldwide falling confidence in technical expertise and scientific knowledge. So everyone remembers, you referenced 2016, Tikki, is when the SDGs emerged. 2016 was also the heat of the Brexit debate. And at that point, a British politician, when confronted with research undermining his favorite political position, he simply announced that he and everyone around him had had enough of experts. In public health, long before COVID-19, so-called vaccine hesitancy or the anti-vax movement had already led to an increasing refusal for people to have their children vaccinated against all kinds of diseases, even when overwhelming scientific evidence showed the efficacy of those vaccines. So 2019, before the World Health Organization became the target for all the coronavirus politicization, we have to remember that in 2019, the World Health Organization identified the anti-vax movement as one of that year's top 10 global health threats. In the midst of all this, you would think that the anti-vax movement, the activism there, would have lost its momentum, but quite the opposite. It has transmogrified into a movement where that protests against the social distancing measures that governments are using to try and keep COVID-19 in check. So it is a horrible tragedy many times over for social, political, economic reasons that were already in motion long before COVID-19. I've used up quite a bit of my time. Let me finish. Everything going forwards will now be more difficult. There's been massive destruction of life. There's been loss of economic prosperity, health, and well-being. The social fabric of modern nations has been torn apart by the COVID-19. within nations as well as across nations. And that COVID-19 shock has been helped along the way by geopolitical rivalry, a disdain for scientific knowledge, and a class war that was already beginning, pulling apart humanity. Whatever are we going to do? Because the loss of economic value means that it will hold back progress across all of the SDGs. Tikki, you referenced, you went and did the research and discovered 33 places where health matters. Economic prosperity matters for all of the SDGs. Without economic prosperity, we will not have a reduction of poverty. This is not rocket science, it is simple arithmetic. With less to go around, opportunity everywhere will be reduced. For the global poor to gain control over their own destiny, they need to acquire the resources to do so from somewhere. Those resources are no longer available or are rapidly being chipped away. And we mustn't forget that in the midst of all this, humanity has decided for itself that even the things that don't cost anything, it doesn't want to give away. What do I mean by that? COVID-19, the lockdown, has had terrible consequences for SDG 5, gender inequality, the reduction of gender inequality. Women in households are finding that under lockdown, they are doubly, triply burdened, with families being unable to pay for housekeeping to come in. Men don't chip in. Women are picking up the burden. So this is a terrible, terrible time. All that fear, what can we do? There are some bright spots. Technology, digital technology has really come into its own. Telecommuting, telehealth, things that we can do with mobile smartphones, we were always able to do. We never realized that we could. Now we can. We need to build on that. Congested cities, a skewed income distribution because of high rents from real estate. Well, we used to think that cities were the place to be. People like to say geography is destiny. Your future is bright lights, big city. Then we realize that actually cities have bright lights and hold out good prospects because they are dense, they're concentrated. So it wasn't geography is destiny, it was density is destiny. But now we realize, hey, you know what? We can actually get a lot of valuable things done without being concentrated cheek by jowl, elbow to elbow in tightly concentrated cities. This will be a massive change in the way humanity organizes economic life. Public transportation, expensive real estate, office buildings, all of that will need to be rewritten. If I had a druther, and let me end on this, global cooperation. I said rather pessimistically 11 minutes ago that just when we need global leadership, it decided to leave the building. The world now faces what economists, game theorists, public policy specialists call a positive sum game. By keeping our neighbors healthy, we keep ourselves safe. By helping others, we help ourselves. More than ever, we need to realize that humanity is going to advance when we fully embrace the idea that we can only raise ourselves by lifting those around us. Let me leave that as the last thought. In this terrible COVID-19 experience, it is a horrible time, but we will need to get through this and we need to look for those bright spots on what to build on. Thank you very much. Over back to you, Tikki.
Thank you very much, Danny, for that insightful analysis of what's gone wrong and what might be the way forward. Once again, to remind everyone to vote, I've seen a lot of questions already, which is excellent. My great pleasure now to introduce Joanne Yoong, who is a prominent applied economist, and she works sort of in the intersection between behavior, economics, health, and socio-economic development. So over to you, Joanne, to hear your insights.
Well, thank you very much, Tikki, and for that incredible introduction, Danny. It's a privilege to be here on this panel, actually today with such an illustrious group of people. I wanted to actually start my remarks by saying that I'm going to pick up a lot of the things that Danny spoke about so eloquently. And what I wanted to do is share with the audience today some of the graphs and data that really have struck me in this discussion about COVID and the SDGs. So I just wanted to bring up again the Sustainable Development Goals. And I want to admit something, that I'm a professional development economist, and occasionally I also forget all 17 of the Sustainable Development Goals because there are so many. And I think looking at them, I want to give everyone a minute just to look at these goals and reflect a little bit on the ambition, the goodwill, and the vision that led us to map out something that was so comprehensive and wide-reaching. Now, the WHO has defined health actually as something that encompasses the physical, the mental, and the social. So, Tikki, when you mentioned that there are 33 health-related goals in the SDGs, I would even take a step further and say that the conception of health itself actually spans all of the SDGs. It is not really that the SDGs themselves involve health, but that our concept of human health has actually, I think, in the last couple of decades been both theoretically and practically extended to cover all of these goals. It covers ourselves, it covers our community, it covers our society, and it certainly covers our planet as well. And because of that, I think one of the realizations that we came to in the last few years, even as we created the SDGs, was the realization that we were not going to meet the SDGs, that this was a path, this was a vision. In fact, it was a mission for mankind, but it was one that was set up from the beginning as a guide, perhaps, and not so much as a goal. What I think we've also begun to realize even before COVID came along was that these goals were very intimately interlinked, but also that we couldn't pursue them in isolation. To pursue, for example, gender equality without understanding that mother's education drives health for future generations and the education of young children is simply not a possibility. We began to realize, I think, as we went into 2019, that there were severe headwinds facing us because we were worried at the time about slowing global growth, about reducing unemployment. And again, as an economist, I think we understand that these are the driving forces of many of the other goals that we face. And we began to understand that these things were going to drag us back in the achievement of the other goals, and that there was severe trade-offs between seeing growth in industry, innovation, and infrastructure on the one hand, but also decent work, affordable energy, sustainable cities, clean water in many areas as well. And so we were beginning to see that not only did all of these have to advance together, but that in many, many important ways, we were seeing unavoidable trade-offs. What COVID has shown us is firstly that those headwinds have become a cyclone. And I think Danny is spot on when he says that the issue here is not that we have 1, 2, 3 of the shocks that we have handled before, but a grand storm of all of these things at once. And so it has highlighted, I think, many of the tensions that we began to face and understand even in 2019, but made all of these things even more pressing and even more complex in 2020. So just to illustrate, I think, again, picking up on one of those topics, I think when we think about gender equality, what we began to understand is that when we think about the health of women and women's health, it's not just in the everyday burden of women's having to deal with both the load of the household, but also the mental burden of managing the task. But in the more extreme cases, when we think about gender-based violence, what we understand is that we can protect women from COVID by having them stay at home, but we compromise their economic opportunities. And in a very real way, hang on one second, I'm going to try to advance the slide. In a very real way, some of the problems and disparities that we saw before are actually exacerbated for victims of domestic violence. So we need to understand that the lockdown itself also creates new risks for women in a very extreme way. So UNFPA has estimated, for example, that a lockdown duration of 3 months is going to lead to 15 million more cases of intimate partner violence. And if the lockdown extends for a year, we're going to see 60 million cases of intimate partner violence, which overwhelmingly falls literally on the shoulders of women. And so the solution in this case very clearly and extremely leads to new disparities and new risks for vulnerable populations that are emerging, in a way that we have to ask ourselves very hard questions about what we do, not just to face the pandemic, but to mitigate that pandemic. Here is a problem that is not just health related, economically related, but also immediately important for the well-being of women, but also for the well-being of children and the future resilience of all these generations going forward. So that's, I think, a graph and a set of figures that struck me very deeply, showing how all of these issues come together at once in this pandemic scenario. The second thing, and so again, being an economist, I must show you some things about unemployment and growth. It is a professional duty. We understood again in 2019 that the annual growth rate in real GDP in least developed countries at least was going in a direction that was very compromising again for the Sustainable Development Goals. And we saw again wide disparities in unemployment across the various regions. I think Danny has already mentioned about the outlook for global growth, so I won't go into that story again. But what we begin to see again, just to illustrate to you the unprecedented nature and emergence of these risks, if we want to look, for example, now at the United States unemployment rate, just to give you an idea of what the scale is. Right, this is the US jobless claims from the 1960s onwards. And this graph in particular struck me because if we look at what has happened just very recently with COVID and where we stand today, what we will see is truly unprecedented levels of unemployment. In parts of the world which were not the major areas of concern before, we are now seeing unprecedented levels of threat to basic livelihoods. And again, coming back to the theme that everything is interconnected, what we have also seen before this emerging in the United States is what we call a rise in deaths of despair. So we've seen rising unemployment rates and issues related to increasing levels of poor mental health and coping in populations that we never had to worry about, the white male middle-aged population. So we were seeing a rise in suicides, in poor mental health, all before the pandemic came along. And now what we're seeing is not just a wave, but a tsunami of exacerbating forces. We're going to be facing an epidemic of unemployment, an epidemic of mental health. In my own household, probably an epidemic of obesity, because all I am doing all day, apart from chasing my children around, is gaining the COVID-19. But we are going to be seeing new threats to security and health at levels that we have literally not seen before and have not been able to imagine. Last but not least, I want to sort of come back to Danny's point, which is that we are at a moment where in the past we have looked towards technology to save us. In 2019, even as we faced unemployment and we looked at slowdowns in growth, we said technology, clean technology is going to save us. Digitalization is going to save us. And today with COVID-19, as we talk about the shutdown, many of us are thinking about how quickly we can come up with a vaccine that is going to change the game. But what we know, so I have two graphs here for you. One on the right is a graph that shows the number and proportion of undernourished people in the world. And what we will see is the fundamental structural determinants of health, actually even before the pandemic, has started to tick down. So the growth of hunger in the world has started to increase even before COVID-19. So there are real structural shifts even before the pandemic that we have to worry about. Something is going wrong in the way that we manage our global economy, even before the pandemic. So the technologies that we look to, the agricultural technologies, the sustainability supporting technologies, had begun to show again strains in ways that perhaps we had not noticed because they were not so obvious, but were already existing. On the graph on the right, I hope you're all right, my left, you're all right, is a graph from taken from an article by Peter Piot and the team at the London School of Hygiene and Tropical Medicine, looking at vaccine acceptance rates. So this is DPT-3 coverage around the world from the 1980s. And what we can see is that immunization coverage leapt forward between 1981 and 1993. But in the past few years, it's really flattened out. So the question is, we've reached this plateau where we've come up to about 80%, and we've been struggling very hard to make that plateau rise. But in 19 countries around the world, we have seen that plateau not just flatten out, but start dipping downwards. And this in countries with high education, these in countries with strong infrastructure. So if we have technology, and we're looking again towards digital technology to save us, and now more than ever, we are looking towards advances in biotechnology to save us as a species, we have to ask ourselves very deep questions that we have begun already to understand we did not fully have a good answer to. If we have technology, how will we convince people to use that technology wisely? How can we finance the distribution of a vaccine in a way that is equitable, that is going to ensure that most populations around the world have access? And how will we convince people at the end of the day, in an environment where they are facing unprecedented levels of scarcity and panic? I also again want to come back to that point that Danny mentioned, which is that as a behavioral economist, we understand that when people are faced with scarcity, when we have time scarcity, when we are faced with quantity scarcity, the natural response of the brain is to shy away from rational thought. We become very myopic, we become very self-centered, we find it very difficult to think about others, we find it very hard to make long-range plans. And in this situation, we are being asked to rise above ourselves and be better for the community and for society. So I want to end off by saying, these are questions that we already had before the pandemic, but they are going to be much more pressing in the post-pandemic world. We look towards the creation of institutions. We look towards goal number 17, partnerships for the goals. I think we'll have a deeper discussion about this in the Q&A. I'd like to turn back to Tikki at this point.
Thank you very much, Joanne, for that those insights. Just a quick comment. A lot has been made about how the vaccine is going to be the magic bullet for COVID. I think that is a moonshot, basically. I am not, because of my background in immunology, I'm not convinced that we know enough about what will make a vaccine work. Plus, this reduced confidence in vaccination is going to make that hard sell. But I better not take up the time for our third distinguished speaker. Very fortunate to have Professor Wolfgang Schuster. Wolfgang has a background in law and political science, and he's a very prominent German political figure. He was a former Lord Mayor of Stuttgart for many, many years, the founder for the European Foundation for Education, as well as a member of the German Council for Sustainable Development. So welcome, Wolfgang. We look forward to hearing your insights.
Oh, good afternoon to everybody. It's a pleasure to discuss with you a very, very complicated and threatening situation. As Danny and Joanne and Tikki already mentioned. I would like to focus, as we experience now, a VUCA world. Yeah. We always discuss this question about our uncertainty, about the complexity, about the volatility, but now we have it. It's a completely new situation, psychologically, socially, politically for us, and the question how we will react. And I just put 5 learnings on to overcome the Corona crisis. I'm very interested in discussing it more in detail with you. The first point is what could be and should be the relations between national governments and international relations. Danny, you already mentioned this issue about the question that we have on one hand naturally the national government's executive power, and they use it. And they forgot what is outside their borders, what is outside another country. And at the same time, you see the political conflict going up, fighting United States against China, and not the spirit of working together and finding common solutions to overcome this crisis. That means we see a very short time thinking. As Joanne mentioned, it's natural for us, if you have a crisis, you have an emergency situation, you just think about the moment, not you think about long term. But what we need is the contrary. We need this long-term thinking. Nobody now speaks about the 65 million refugees. Nobody is talking about the SDGs and in which way the SDGs could help to overcome the crisis. But on the other hand, at least I see some very positive elements. For example, the very good new quality of global cooperation of universities, hospitals, companies, research institutes to look for solutions which could help and hopefully will help on a global level for all, particularly for the undeveloped and developing countries. The second question, which is linked with this, is the relation between the public authorities and us, the citizens. We have, maybe you remember, 10 years ago, we had this banking and financial crisis. Until this point, we had a global mega trend. We call it neoliberalism. We had a global mega trend that means less public services, less control, less regulations, more freedom for entrepreneurs. And by this, less authority means less taxation, more free market. And then we saw this crash, this global clash. And if you analyze the different concepts, all states with a well-functioning, qualified public services in fields of education, infrastructure, health, mobility, and so on, they have higher taxes, but they are economically stronger. Interesting enough to see what could be the balance now between citizens and public authorities. In this crisis, we estimate, we value the reliable functioning of public health services, for example. And the citizens, if you ask them what you need, they ask for more secure living, for more prevention, for more provision. They would like to see more public intervention in the labor market to save their jobs, to secure their income. And that means in consequence that the model we have in partly, particularly in Europe, the social market economy model, means we have many instruments to avoid mass dismissals, high unemployment, as we see it now in the United States. Joanne, you mentioned this dramatic. They have now 40 million unemployed, 40 million people, and behind their families has no income, have no social security, have no health insurance, and it's dramatic. And therefore, we had other instruments. For example, we invented, in the last crisis, we invented called Kurzarbeitergeld. That means short time allowance, that if you have though you stay employed, you stay in the company, you have your income smallly reduced, but you have your income, so you can continue your life. And if the demand is coming again, and I'm sure there will come the demand again in maybe 5 or 6 months or even a year. So it's not the complete economy going down, it's just partly. So there are instruments to fight the crisis. Another aspect, which is already mentioned, was the new balance between global and local. We all knew this mega trend of globalization by economy, by digitalization, by media, also by people. And by this, in consequence, our cities became more and more global villages. adapting the style of architecture, mobility, lifestyle, food, fashion, and so on. And we saw more and more people becoming, we call it anywheres. That means modern nomads. And now suddenly this has completely changed. We have now the unlimited moving is over, at least in the moment the borders are closed even in Europe. So and therefore we rediscover our local situation. We rediscover our neighborhood. We rediscover our cultural roots, our ecological environment, and many other things. And that, for me, it could be a chance, a new chance for the engagement of citizens in their own environment. But for this, you knew that's my fourth point, you need a stronger local self-governance system. And this is a goal of also in the SDGs, number 11, creating sustainable cities and communities, sustainable also on the social aspects, ecological aspects and economic aspects. What is behind? For me, it's very important to come out of the crisis is not only have a top-down approach, although you need the bottom-up approach, which to balance on one hand the power and competences of public authorities, but also to have the freedom of citizens to act, to do something, to come out in a common spirit. And my vision as mayor was always to develop municipalities as communities. And in our tradition, we have this chance. And I just want to mention our constitution, our German constitution. There's written, the municipality is responsible for all local issues, and it has the right to receive the necessary financial resources to fulfill all these competences. And for us, it was very important that I was always active on the European level to say that we need this idea of principle of subsidiarity on two levels. And it's now written in the Lisbon Treaty and the European Union Treaty. Always the public authorities is responsible, which is the closest to the citizens, as long as it is capable to fulfill this task. And if not, then the next level of politics is in charge to fulfill this. And I think it's an incredible chance to think about activating the communities, creating communities. And this principle of subsidiarity has a second function. As a public authority, as local authority, you can transfer public services to non-profit organizations. And in a city like Stuttgart and Munich and others, we had hundreds of these non-profit organizations doing education in the field of education, social health, and so on, with kindergarten, schools, home of elderly, and so on. And by this, you have many, many people get involved. 20% of the population of Stuttgart are doing voluntary work. That means you have this approach coming from bottom up. And what Danny, you said, by helping others, we help ourselves. Exactly this is idea to create a feeling of belonging, of co-designing, of participating. And this is very important in a very heterogeneous society, and our urban societies are very heterogeneous. In Stuttgart, living 170 different nations. So it's very important to think about how we can create, coming out of this crisis by creating the idea of community. But for this, you need the legal framework. You need the competences, legal competences on the local level. And to involve, and by this many, many citizens, and by this come closer to what we see in the SDGs. Learning, the last point for me is the question, maybe we should just in our future to redefine the VUCA world. We need a vision, we need a common understanding, we need more clarity, and we need naturally the flexibility. And as it was mentioned, the 16 SDGs with all these other goals are very complicated to understand. And my thought was, maybe we should just focus and say, okay, let's now, because everybody is touched with this health issue, maybe we should focus on the good health and well-being, which is linked with all the others, as it already was mentioned it, which is linked with the question of healthy ecological environment, healthy food, with a better medical services, with better education, and so on. So that means it could be a common learning process to say, let's focus, because everybody will understand what that means, good health and well-being. But finally, I think it's very important going out of the crisis. It's a common effort. We start top down, but also we start bottom up, because it's finally our decision, our lifestyle, our learning process, including everybody in this process to overcome this crisis, and maybe and hopefully to come a little bit forward in achieving the 17 SDGs. Thank you.
Thank you very much, Wolfgang, for that very nice overview of some key learnings that we might keep in mind moving ahead. Okay, so the schedule says that we will now have sort of a discussion amongst the panelists, but I'm a little bit worried about the time. So in the interest of time, I think I'm going to propose that we just sort of go straight to the Q&A, and I will make some sort of concluding comments at the end, because it is very good that we seem to have a lot of questions. And once again, to all those online, please post your questions and vote on it, and we will try to deal with as many as we can. So without any further delay, we've talked a lot about the importance of health, overall well-being, the issue of mental health. So the most popular question that I see here on my screen is what is the impact of the pandemic and COVID-19 on social aspects of education, specifically on the growth of minds in the new world? So that's quite a broad-ranging question, but obviously quite central to how, like what Wolfgang mentioned, how citizens are going to sort of react in the future. So let's take that on, the impact on social aspects of education and the growth of minds. So behavioral economists, you want to have a first crack at that? Over to you, Joanne.
Yes. Well, I think there's so many dimensions to that question. I think that it's a very challenging question to answer. So let me kind of try to break it down a little bit. I want to talk a little bit about what are we seeing in terms of impacts on the formal education that people are receiving, or in many cases now not receiving. And then I want to talk a little bit about how the other sort of features of informal education are sort of kicking in. So when it comes to how the pandemic, I think, is shaping education, what we can see is that clearly we are winging it. We are winging it. We have, what the pandemic has done for us is open up a whole new world of digital education, a direction in which we were moving slowly, and we were in no way ready to go fully online. Right? So we've moved to a situation where many people are homeschooling now. And so the quality of education, I think, has become very challenging for many people. And the mode of digital education is very different. Taking a class and putting it on Zoom is not the same as delivering education on an online modality, which is entirely different in the way that we communicate, in the way that different types of learners respond. So if you are an auditory learner, if you are a kinesthetic learner, it's very challenging for you to learn online. If you are a visual learner, that's quite different. But people learn in different ways, and many people learn in a way that is much more facilitated by face-to-face learning. So in many ways, number one, the quality of formal education, I think is very much in flux. And the extent to which we have a digital divide now exacerbates those. We already had large educational disparities and we had a digital divide. And now we are going to overlay the digital divide on top of the educational divide. And we are going to look at households that basically did not have sufficient access to the internet or formal education, now struggling on 2 dimensions. I'd also say that the aspect of socialization that we had in the classroom, all the lessons that we learned from being with other children and other people, really are things that we again are struggling to reformulate in the digital world. We are finding new ways as a society to relate to each other online, and I think that goes for the classroom as well as in any other place. But I want to come back again, and this is also partly because I am an unwitting home-based learning coach, to Danny's point, which is that we are also, the social aspect of education is also now being very driven by this gender problem. And we are seeing that women are taking on the brunt of the makeshift version of education that we are having in the home. So where we are also transmitting a lot of lessons about gender roles inadvertently through the way that we're delivering education today. And that's also, I think, a real problem. On the macro level, I think it's very ironic because one of the conversations that we've had in the past, and I distinctly remember having this conversation on another panel, is how do we teach children in a world where they may be too comfortable and have it too easy about risk and grit and resilience? Well, that is a conversation we no longer need to have. But I think a lot of the discussions that we had, again, prior to the pandemic about teaching children about grit, resilience, agility, a growth mindset, are all things that have now come very firmly forward. It is going to be not just how we teach them in the classroom, but how we as a society respond to this pandemic. I think one of the things that I think when I first realized that I was failing miserably at home-based learning is someone told me that I really took very much to heart. You are teaching children every day about how we as individuals in a society manage a crisis. And those are very important lessons. We cannot today, I think, tell young people anything certain about what the employment prospects are going to look like, what skills they need to pick up for the jobs of the future, because we don't actually know at this moment what that's going to look like. But we are teaching them a lot of things about how to operate in society. Some of those lessons they're learning are the wrong lessons. Some of them are the right lessons. But we need to understand that education today is also about how we're responding to the pandemic in our everyday lives.
Well, thank you, Joanne. And I really fully agree with what you've said. I conducted my last 3 classes through Zoom, and I distinctly detect a disease amongst the students and even me, and it's called Zoomitis. Okay, so in addition to webidemics, we now have Zoomitis. Okay, thank you for that very nice answer. Professor Schuster, as a founder of the European Foundation for Education, do you have any sort of anything to add or your own views about the social impacts on education, the growth of minds amongst the young people, to what Joanne has already said?
First of all, Joanne, I think you're completely right about digital education. That's our experience too. And I was also president of the Telecom Foundation, and on this time we focus on the question how to link the digital world with the school world. And it was very clear that you need the teachers. The teacher play a central role. And unfortunately, it was not possible to win all the teachers to think about new pedagogical concepts on one hand, personally and online, to mix it in a good way. But now we have the situation, and it shows exactly the question of digital divide. It shows exactly the question of social behavior. It shows all the tasks and the duties go now to the women, and so on. As everything what you mentioned. I would like to add just one thought about the social aspect of education. I started with my presentation with this VUCA world because we were not used anymore to think about risk and And when it was adventure, it was in holidays, and you buy a lot of to pay a lot of money to get a little adventure. No, the mentality, it's a little bit a nanny state. You are expecting now that the state is looking for everything, caring for everything, all the kind of preventions, provisions, security measures, and so on. And I think this spirit can be very dangerous, because it's exactly the contrary of what we have seen with this neoliberalism. You know, less state, less public services, reduce regulations. Now we see exactly the contrary. And some authoritarian politicians use this now to reduce our personal freedom, because because you are very relaxed if you know the state, the public services are looking for everything. But on the same time, they are monitoring you, they control you, and this will go up to the question of this full service mentality, up to the question of a total control of our lives. That means you will not accept any risk, and by this you come finally to an unfree society. And what we see, as everybody knows, in China, they tested the social score model, which will be the end of individual freedom. And I think it's very important, social aspects of education, that you make very clear. We are living in a society in which we have risks, in which are danger, and we have to learn how to get along.
Thank you very much, Wolfgang. Danny, I know just in the last 24 hours, NUS, the university, is struggling with reopening the campus, and I'm sure as dean, these are some difficult decisions you have to make in terms of how do we go forward in terms of how we conduct our education, our teaching in the coming academic year. Any thoughts on this question of social aspects of education?
Yeah. Thank you, Tikki, and thank you, fellow panelists, for some really interesting points and discussions that you put on this question about the social aspects of education. You see, I entered primary school when I was 5.5, and I haven't left school for the last however many decades. I am still working in an educational institution, and at no point have I ventured out into the real world. So to think through what's happening now, you know, we at all levels, whether it's from primary school to postgraduate education to university, we humanity societies have used the school institution in an overloaded way. When we were in kindergarten or primary school, it wasn't just about giving kids ABCs and arithmetic training. It was about the school being a babysitting service. It was about the school helping provide a civic consciousness. It was about the school trying to socialize the kids in a way that would allow them to be able to venture out in society. And in a way, we've continued that model all the way through university and postgraduate education. We talk about schooling as provision of skills, but the reality is provision of skills is a tiny part of how the education industry has functioned. Now, this overloading has worked for us for the last however many decades, because concentrating young children, concentrating young people in an environment that allow them to mature and build out in all these other kinds of ways was a very efficient way to also get them to learn about engineering and chemistry and science and all the rest of this. It worked. But the new world that we're moving into is one that disputes the benefit of congestion and density. It says that to keep ourselves safe, social distancing might be with us for a very long time. And it's not just the development of a vaccine. I agree with Tikki, that's not on the horizon, but going well beyond that. So the impact, in terms of what this question is asking, the impact is we have to sit down and think really hard about how we unpack the different functions of a schooling institution. Do we just go online for picking up programming skills and coding skills? Do we do socialization in a way that's outside of a school? Do we teach civic consciousness in a way that's not conflated with learning about ABCs? I think those are hard questions we all have to ask ourselves. In terms of the very specific, concrete question, Tikki, that you posed me, what's going to happen at the Lee Kuan Yew School? How is NUS navigating this? You know, we have considerations in mind. We need to keep our students, our faculty, our administration, our community safe and healthy. At NUS alone, we've got over 50,000 members of the community with a tiny, tiny rate of infection. You know, it is very easy to imagine, even at very low rates of infection, it's easy to imagine how a community like that is, you know, shows the potential for cluster emergence. And we are scrupulously careful in how we're assigning different zones of work, different timings of work, different ways in which we are now going to take the community forwards. And it is a system that I think has been very thoughtfully put together. And I suspect it's a system that many other institutions are going to be trying to use as well.
Okay, thank you so much for your three inputs. For now, I'm going to sort of move backwards. The question that has the most votes is actually directed at Danny. So, Danny, in your latest article on Straits Times, you talked about the trade-off between global efficiency and local resilience. Does building local resilience include cutting our obsession with low-wage foreign labor in exchange for a lift in living standard for all, regardless of skill level? If yes, how should the public and private sector share the cost of such an adjustment? So over to you.
Thank you, Tikki, and thank you, Teng Teng. I think that's a question from my friend Teng Teng at the Head Foundation. There are narrow issues involved here and large issues involved here. I mean, my colleagues in the economics department at NUS have tried to think through the way in which the wage structure that we have in the Singapore labor market both reflects and drives not so much an obsession with foreign migrant workers, but a reliance on them. And this reliance in turn feeds on the source of foreign migrant workers, where they come from, because a lot of what they've earned in Singapore, which comes across to them as relatively high wages compared to where they were originally from, is then fed back to the villages or the geographies where they've come from. So there's a circle of things involved here, and we need to be very careful. It's not the question of short-circuiting one part of this arc of activity, because if you deprive foreign workers of work that they want to do, that has dramatic implications for the poverty situation where they come from. Having said all that, the current situation is one where we do rely on certain segments of the labor market to keep our lawns well trimmed, to build our buildings faster, to bring online MRT stations ever more speedily. And we are involved in this race to keep things comfortable, pristine, ever looking forwards to the next great thing. It is a wonderful ambition to have. It is a wonderful ambition to have, and what we need to make sure is that in the race to do this, we don't fetishize only those who come out at the top of the income distribution, that we continue to pay mind to how all these different things work together. Let me rephrase the question as well, Teng Teng, if I may, just a little bit. If I took out the word foreign or migrant workers in this question, the question would still remain valid. We would still have people at the bottom of the wage and income distribution that are doing deadly, dangerous, potentially debilitating work. And societies, all societies, will still need to think about how we take care of all of our people.
Thank you very much, Danny. And I sense the theme of dealing with inequality coming right across many of these questions. Wolfgang, I have a question that's been posed by Jasmine Ng here. Hi, Professor Schuster. What do you think is the impact of COVID-19 on democratic versus authoritarian institutions? How have the different political systems responded to the pandemic, and how will this pandemic affect democratic freedom and the free market? I think with your background in political science and public service in Germany, I think you're the perfect person to try and answer that question. So over to you.
Thank you very much. I just mentioned this alternative model of a nanny state. That means a state who cares about everything. At the end of the day, you will lose our freedom, we will lose our basic rights, or it's at least a danger of it. And therefore we have a discussion, I think not only in Germany, about this appropriatedness. That means a balance between what are the control and the regulation of a government on one hand, and what are the rights you have as an individual on the other hand. And we have to really be careful not to dismiss this balance. If you think about what's going on in Singapore, it's the same like in Spain or in France. Here in Germany, it was not so rigid, but at least we lost a lot of our normal rights to meet others, to go everywhere, and so on. And therefore, I think it's very important as a citizens to say, okay, we ask the political responsible people about this reasonability, complicated word. What are the reasons? And if the situation is changing, you have to reduce the control mechanism. You have to give more freedom. You have to change the legal limits we have in the moment. I think it's a very psychologically very important also because at least in Germany, we have in the moment a high confidence in our government. Interesting enough, it goes up because everything, okay, they did a good job in the crisis, in the beginning of the crisis. But now it goes down, and therefore it's so important to say, okay, we as citizens, we have our fundamental rights, and we will keep, and it's very clear for me that the politics they have to justify any kind of control, any kind of reducing our freedom. I think that's a very important element in the discussion we should have as a public discussion, not just with some. Naturally, we have some demonstrations and some, which is fine, but in fact, it's a very basic issue, particularly if you think about that this pandemic maybe take quite a long time, and maybe next year there will come another virus, and therefore it's for me it's a very principal issue.
Thank you very much on that.
Tikki,
Danny,
can
yes?
I jump in?
Go ahead.
Can I jump in on this as well?
Sure.
At some point, years from now, some student of epidemiology, economics, and statistics will run a regression. And they will look at the world and they will say, look at these countries that were called autocracies. Look at these countries that are called Western style liberal democracies. Correlate that with the number of deaths, the rate of infection across these societies. And they will say how does this compare to what is supposed to happen? I think that is the thinking that lies behind this question, and that lies behind Wolfgang's very, very nuanced answer on this. And let me suggest maybe 3 points on this very quickly. One is that we were always told that autocratic societies might be able to plan for smooth trajectories, but they were never able to be robust and resilient when unexpected shocks hit them. It was democracies that were supposed to have that resilience. In the current situation, the unexpected shock that has hit us has led to the United States having the greatest number of deaths across countries, followed by the United Kingdom, and Brazil having the second highest number of infections, following the United States again having the highest number of infections. These wonderful Western-style liberal democracies, Western-style democracies, do not seem to have been able to do the job. And what's even more puzzling for people to think about is that, hey, wait a minute, if all of this is also about COVID-19 disproportionately affecting the poor, those poor workers in foreign worker migrant dormitories, those workers in favelas, isn't Western-style liberal democracy supposed to protect everyone, especially the poor, and not just the rich? What has gone wrong in this? And I think this is a real learning point that the world is going to have to think seriously about as it goes forward. And I want to suggest just 2 things. One is democracies are as good as the leaders the people elect. And the people seem to have elected political leaders that have made many missteps in the United States and in Brazil, and to some degree in Great Britain. The final point, the second point and the final point is democracy is indeed supposed to be about taking care of all the people. But what it has become in the early 21st century is something else. It has morphed into a misguided belief that you, Tikki, are a great epidemiologist. I know nothing, but my ignorance is as legitimate as your scientific expertise. And we have been led into a world that completely turned upside down. It's not just, it is a really important learning point that we have to take forwards if we're going to expect systems of government to survive. Back to you, Tikki.
Yeah, thank you very much, Danny, for those insights into this clearly very central issue that, as you say, there will be much analysis going on after this. Let me just add to that. I want to build on your point of the leaders that people elect. The point I want to make is that countries that have done very well actually in dealing with the crisis, think of the leaders of those countries. Think of Jacinda Ardern in New Zealand. Think of Angela Merkel in Germany. Think of Sanna Marin in Finland. And then think of Boris Johnson, Donald Trump, and Jair Bolsonaro. The 3 countries that have done well are led by women. Okay, I mean, anecdotal, but it's just an observation. So that allows me to ask Joanne a question that actually is being very highly voted. On the issue of gender inequality, a significant proportion of essential workers are undertaken by women. If these workers are essential in a crisis, why do you think is their labor so undervalued, underpaid, regarded as unskilled in normal times? Do you think this traditional notion of what constitutes value in capitalist economies will and should be corrected after this crisis? Over to you.
Well, my sense is that a large fraction of care work, whether or not it's undertaken by women or by men, has been systematically undervalued. We talk about informal caregiving at home. We talk about not just our healthcare workers, but our teachers as well. Our teachers are underpaid relative to, I think every parent today now would give $1 million to any teacher who would now take the. We now understand, I think, much more what it actually takes to maintain a classroom. But my sense is that yes, care work has been undervalued in our society, partly because our perception is that anyone can do it, but it has been overlaid with these gender norms, and we don't fully understand or appreciate the opportunity cost. I will say that again, I want to abstract a little bit from the gender issue and focus on the role part of this. Do I think that this will change? Should it change? I think I want to separate very much the should it change from will it change. And should it change? It has always been the case that it should change before or after COVID. Will it change? My sense is no. I do not think that after COVID, we are going to go into a new world where we pay our nurses what we pay the doctor, firstly, because of the scarcity of skills. Or I do not think we will jump back into a world where the value of unpaid caregiving is suddenly monetized. And I don't think that we will come back into a world where at the end of the day, we actually value household labor or in the way that we value market-based work. There's simply, coming back to this discussion, we will have to ask a lot of the questions, similar to the questions that we have to ask ourselves of democracy, autocracy, all of these things that are very highly systematic. We'll have to ask ourselves very penetrating questions, but I don't think we will see the change as quickly as we hope.
Thank you very much. That's a very nuanced answer. Okay, I'm sort of aware of the time. Since the three of you have been very good in answering these questions, it probably would not be fair if I just sort of take the default and not answer any. So I'm going to try and answer one question from Daniel Lee. Do you think that the world would be more resilient and prepared for the next potential pandemic outbreak? What are the top 3 priorities for outbreak prevention and the top 3 priorities for outbreak management? So I'm going to try and answer that very quickly. Top 3 priorities for prevention. Good personal hygiene to be continued. Second, education and awareness and social responsibility. And finally, and this last one is a bit controversial, is what I call source management. Many of our countries in this region like to go to markets where wildlife are slaughtered and then eaten. Okay, that's my own personal view. That's the source of the outbreak. So we need legislation, we need enforcement for those markets to be closed to prevent something like this happening again. So that's on prevention. On management, that's an easy one. Rapid and extensive testing, contact tracing, isolation and quarantine, restriction of movement. Okay, so I've done my share, one question. Thank you very much. I'm aware of the time, and for the next 5 minutes, I'm supposed to make some concluding remarks. I'm not going to try and summarize the very rich discussion that we've had, but perhaps just to share with you some reflections and conclusions perhaps that I've sort of gained. These are just, I wrote this as you were talking, so forgive the any omission. Okay, what's next? Just some closing remarks from the very rich discussion we've had. These are Danny's own words, okay? No such thing as a free lunch. Hard work and many difficulties lie ahead across all sectors, as Joanne highlighted, not just health. They are all interlinked. We will be looking at sacrifices, trade-offs, pain, restrictions. This will definitely be a feature of the post-COVID era. Secondly, I think we talked a lot about the risks as well as what can be done. As mentioned in many of the questions and the presentations, the potential is there to increase disparities and inequalities. So we need to protect the vulnerable and the disadvantaged. And something that I thought was very interesting, this myopic perspective that Joanne mentioned, could be a risk for a movement towards isolationist and more sort of selfish policies rather than collaboration and solidarity. And finally, something that, as a scientist, I'm particularly worried about the continued denial of the value of science and evidence in decision making. So that's the sort of the second reflection. The third one is, I think, something that came right across, and I think Wolfgang's intervention was particularly strong on this one, the need for multi-sectoral partnerships between all the key actors, governments, citizens, corporations, international organizations, at all levels, not just top-down, but bottoms-up, which is crucial for us to prepare and rebuild our institutions with strong foundations and good governance for a more secure future for humanity. And I think in the context of what's happening in the future, there is clearly going to be a lot of difficult choices to be made by our policymakers in the context of sacrifices and trade-offs, etc. And finally, I think this is just my own view, that what the world has witnessed during the pandemic is not so much an indictment of globalization, but a reaffirmation of interdependence among the nations and peoples of the world. I think more than anything, it is not saying that globalization is bad, that has led to this crisis, but actually reaffirming the need for solidarity and collaboration. As I said, policymakers are going to be faced with many difficult choices. As Einstein said, what is right is not always popular, and what is popular is not always right. And finally, in the context of the future, Warren Buffett said on What's Next, predicting rain doesn't count, building an ark does. That's preparation. So thank you, everybody, for this wonderful webinar, for all your wonderful contributions. I think we have finished right exactly on time. Thank you very much, and hope to see you all again soon. And just also to mention that the HEAD Foundation is planning a series of these webinars, and there may be 2 or 3 more coming up on other aspects of COVID-19. So stay tuned, and thank you once again. Bye-bye.